everyone, greetings of the day. I am Sanya from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infection or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infection can look like a rash and can be itchy and annoying too. So let's connect today with our skin expert, Dr. Mugdha Kulkarni Tiwari, live from Varanasi to enlighten us on the topic of antifungal. Dr. Mugdha Kulkarni Tiwari is an MBBS, MD, DVL. She has many years of experience in this field. She offers patient friendly scientific advice to your problems while maintaining the highest professional and ethical values. She is currently practicing at Sri Vinayak Skin and Aesthetic Cleaning, Varanasi. Ma'am, we welcome you today.
Thank you very much for your warm welcome.
And ma'am, as we are going to talk about a very important topic that is antifungal, let's start with the very first question that what are basically fungal infection, how they are caused?
Yeah, so fungal infections are basically any infection which is caused by fungus. So now fungal infections primarily they can either affect the skin, they can affect your hair, they can affect your nails. Similarly, there are fungal infections which affect the superficial skins, fungal infection which affect the deeper layers of the skin, and there are fungal infections which can even enter your bloodstream. So currently we'll be discussing mainly the fungal infections that affect the superficial layers of the skin, the hair and the nails.
Okay, doctor. And doctor, as we are talking about fungal infection, what are the types of fungal infection and what are majorly the causes of fungal infection?
So see, the types of fungal infections are basically on the basis of the sites which are affected, like the ones which are affecting the skin, the ones affecting the hair, the ones affecting the nails. And the common causes are basically certain comorbidities like in patients who have diabetes, patients with low immunity, patients with poor nutrition, patients who are working out a lot, who sweat a lot.
Okay, okay, doctor. And doctor, if how to take care of fungal infection and how to tackle the same if someone is having fungal infection, how someone should take care of the infections?
Yeah, so firstly, what is important is you visit a registered medical practitioner, you visit a proper skin specialist for the same. Secondly, it is important that you don't try any home remedies or you don't use the over-the-counter creams which you get, because these creams often contain irritants or they contain steroids. So they might further damage your skin. So that is again important. Thirdly, taking precautions such as washing your clothes every day in hot water, ironing them, laundering them, washing your clothes separately so that the infection doesn't spread to your family members. Similarly, all your personal items such as caps, scarves, nail cutters should be kept separately. Similarly, your soap, your towel should also be kept separately, and so on.
Okay, okay, doctor. And doctor, as we are having rainy season, so is it like that the fungal infections are more in this particular season, and what precautions one must take while going out in rainy season?
Yes, fungal infections are common in the rain because there is humidity and fungus grows more in a hot and humid climate. So pertaining to the rains, see during the rainy season, fungal infections are more common in the groin area. Why? Because you sweat a lot. So it is important that if you're getting wet, when you come back home, take a bath, dry properly, or if bathing is not possible, at least change your clothes. Secondly, try to wear open footwear. Avoid shoes, avoid socks. In case you're wearing shoes or socks, make sure that you change your socks regularly. Get two or three pairs of shoes which you can uh, put it in the laundry or put it out just to dry. Typically, if you keep your stuff away for like 7 to 10 days, it kills the fungus. So you can like change your shoes, you can alter between them over the week.
Okay, doctor. So these are the precautions one must take while going out in rainy season, as you told us that in rainy season the fungal infection are more because of humidity. And doctor, what are the possibilities that the fungal infection, can grow in nail because nails or hair, because some of people use over the counter products. While they have something on their hair or nail, so they think that this is just a rash. So, what is your advice to the people?
Yeah, definitely. See, most commonly people acquire scalp fungal infection or infection of the hair via infected towels or infected scissors or any other hair styling products. So it is important that you visit proper salons which take the necessary precautions, and you avoid sharing your hair styling tools or avoid sharing caps or scarves with someone who has fungal infection. So that is important. Again, do not share razors. That is also very important. Often people end up sharing razors or trimmers. So that should not be done. And as far as nail infections are concerned, again, it is important to not share the things like the tubs which are used for the pedicure, manicure, or the nail styling tools or the nail cutters. So they should not be shared. If the instrument used is infected, there is a possibility of acquiring the infection from there.
Okay, doctor. So these are the precautions one must take, while visiting a salon or not using towel if somebody is having fungal infection. Doctor, here comes a question that is fungal infection contagious? It can spread from one person to another.
Yes, it can spread. So all these precautions need to be taken of, keeping your personal items separate, not sharing clothes, not sharing towels, not sharing soaps or any headgear or any instruments. Preferably, you should wash your all the personal items in hot water, let's say around 45 to 50 degrees, and put it out to dry at least for a day whenever possible, or simply just launder your clothes. Even putting them in the laundry or using a hot iron over them can be sufficient.
Okay, doctor. So I said that cleanliness is very important, plays a very important role in everybody's life. And as you said that if somebody is having fungal infection, they should definitely clean their clothes, wash them, and try them out. Doctor, when we are talking about fungal infection, what is the most serious fungal infection?
See, the most serious fungal infection is the one which is affecting the internal organs. So something like candidiasis, which can begin as a mild infection of the skin, but if the patient has low immunity or if the patient is on certain drugs which lower the immunity, or in case of diabetes, the infection might spread to other oral cavity or vagina or the genitals in case of males. So yeah, then that can lead to serious side effects.
Okay, doctor. And doctor, when one should, see a particular kind of infection and realize that they have to go to a doctor, how can one identify that this is a fungal infection and they need to see a doctor?
See, fungal infection of the skin usually presents as a red rash that is circular ring-like lesions. So it is also called as ringworm because the lesions are like red, they are circular, they might have a central clearing to it. Alternatively, they might be like small red spots or pus containing lesions. The most commonly affected areas over our body are where we sweat a lot. So, like armpits, the groin regions. In case of females with heavy breast, below the breasts. So, yeah, these are some of the most common sites. If you're getting a rash or you're getting a peeling of skin, it points towards a fungal infection. And similarly, in patients who do a lot of outdoor activities like gardening or farming, or um, they are in certain occupations that they are in contact with water or detergents a lot, the spaces between your toes and fingers, they are also a common site. So in case of toes and fingers, it's usually there is like whitening of the skin in between the toes. So again, that points towards a fungal infection. And as far as your nails are concerned, your nails will start to get discolored a lot. So there will be blackening or brownish or yellowish discoloration, which again points towards a fungal infection.
Okay, okay, doctor. So these are the symptoms of fungal infection. If somebody is having a round rash or the nails are getting yellow, these are all the symptoms of fungal
Yes.
infection. Okay, okay, doctor. And doctor, as we have discussed about the fungal infection, the types of it, the symptoms of it. Now, let's talk about what are the treatment which are available for fungal infection. Because people think they use over-counter products or over-counter powders. They get it better and then they don't go to a doctor. So, talking about the treatment, what are the various treatment which are available for fungal infections?
See, as far as treatment is concerned, over the counter preparations which contain multiple agents, like multiple drugs, they are usually a combination of antifungals, antibiotics, irritants, or steroids. They should not be used. They are a complete no. Because what they will do is they will further damage your skin. The patient might feel that the fungal infection is getting better because the redness will reduce, but the fungus will not clear out of your skin. So when you stop the treatment, again it will grow back. So that is how you know that the creams which you are using are not correct. So it is important to visit a proper doctor who's trained in treating such infections, so that they can assess you and they can prescribe you the antifungal therapy. See, the antifungal treatment usually depends on the age. It depends on what other medications you are on, whether you have any comorbid factors like your immunity is low, you have diabetes, you have hypertension, you have certain kidney or liver disorders. So the choice of the antifungals depend on these factors. So if the fungal infection is milder, your doctor might prescribe you just something for your itching and a cream or a lotion. But if it is more severe, you will need oral medications in the form of tablets or in the form of capsules.
Okay, okay, doctor. So there are different types of treatment for different type of fungal infection. If somebody is having fungal infection here or nails, so there will be different types of fungal infection. Doctor, some people also do home remedies if they think that applying coconut oil or any home remedy. What is your advice to the people who use home remedies, and they should use it or not?
No, home remedies again are a complete no, because what we commonly see is patients apply things like Dettol or Savlon, which are great for other things. Definitely they are antiseptics, but then they don't have antifungal properties. So if you apply such irritants to your skin, what it does, it peels out the skin layers. So then you are left with ulcers, or you are left with erosions, or you are left with very sensitive skin. So in that case, we need to like heal the skin first and then treat the fungal infection. So such remedies are a complete no. Similarly, if you apply some over-the-counter drugs, or you use some powders which can again irritate your skin, So the skin will further become more and more red, or it might peel off. So it should be avoided definitely.
Okay, so the home remedies are not that preferable, and you should definitely not use home remedies. And to all the viewers, we have today with us Dr. Mugdha Kulkarni Tiwari from Varanasi, and we are talking about antifungal. Doctor, now we have some live viewers' question as well who are watching this live. And as we were talking about antifungal medications to fungal infection, here comes a question: that is it safe to apply antifungal cream on underarm rash?
Yes, it is very much safe provided the rash is really of a fungal etiology. Then yes, if it is fungal, then you need a cream or a lotion.
Okay. And so it is safe to apply antifungal medicines on the underarm infection. Doctor, here comes a question: that why does fungal infection occur again and again?
See, if it is occurring again and again, there are two possibilities. One is that it never really went. If the person having the infection did not take the proper course of the treatment, if it never left your skin, then yes, it might come again. Like if you don't take the treatment properly, or you're taking it on and off, stopping and starting, or if you're forgetting to take the tablets or forgetting to apply cream, that is the most common cause of why it reoccurs. And secondly, it is that you're not taking proper precautions when it comes to cleanliness, like bathing twice a day, or not changing clothes every day, or if you're working in a very hot and humid environment where you're unable to change clothes frequently, so then yes, that is another factor. And thirdly is sharing of again the personal items. If one of your family members or friends is having a fungal infection and you're using his or her products, or his or her clothes you're sharing, or sharing of towels, then yes, it can come back. So these are some of the common factors why it keeps recurring again and again.
Okay, so these are the causes why the fungal infection are recurring again and again. Doctor, some people also do that. If they see the early symptoms are gone, the itching is gone, the redness is gone, they stop taking the antifungal treatment. What is your advice to the people who stop taking antifungal treatment, and if their symptoms get better earlier?
See, that is one thing that should not be done at all. Because what happens is the symptoms will start to reduce. The patient will feel that it has gotten cured. But that is not the case, because the fungus cannot be seen by the eyes. It can only be seen with a microscope. So even if you see that your rash is reducing, your itching is reducing, the fungus is still there within the layers of your skin. So until and unless you're not taking a proper course of the antifungals, that is, you will stop treatment only when your doctor suggests you to stop the treatment. Because what happens is, if you like take the treatment on and off, the medicines which are working for you might stop working. That is, there might be development of antifungal resistance. So in that case, what began as a very mild infection which could have been treated very easily becomes something which is more difficult to treat, and you need to give more expensive drugs, more costly drugs, and higher drugs basically. So that should be avoided. It is advisable to like follow what your doctor is telling you, go for regular follow-ups, and basically take the treatment properly.
Okay, okay, doctor. So, as doctor said that you have to take care of yourself and do not avoid not taking the antifungal medications. As doctor told us, it is very important to complete your treatment. Doctor, there are more questions from our viewers watching this live about antifungal. There's a question that is it normal to feel a burn after applying any sort of cream on the rash or the affected part?
No, it is not normal. Usually, the proper antifungal medications, when you apply it over your rash, they don't itch or burn. So, if you're getting itching or burning, it means that you have already applied something on your own, or you have scratched so much that the creams which you are applying are causing itching or burning. So, no, it is not common for the creams to burn or itch.
Okay, so it is not normal, and please do refer to doctor, because as doctor said that it is not normal to feel burn. Doctor, there's another question that can I buy antifungal without a prescription?
No, you that is again not recommended because, like I told earlier, if you just use some over-the-counter creams or if you're just using creams on your own, there is a possibility of developing antifungal resistance. So if that happens, you would need a higher dose, a higher duration of therapy, and you will further complicate things. So again, that is not recommended.
Okay, so it is not recommended to use any kind of medicines or antifungal without prescription. Doctor, here's come another question that can oral antifungal drugs can be taken during pregnancy?
No, oral antifungal drugs cannot be taken during pregnancy.
Okay, doctor. So it is not advisable to take the oral antifungal drugs during pregnancy. And doctor, here's another question that are taking antifungal for long term is safe for the body?
See, the duration of antifungal agents depends on the kind of infection you have. So, your skin doctor will prescribe you the proper dose and the proper duration as per your need. So, the duration varies from person to person. It depends on the type of infection you are having, the duration of the disease, any other comorbidities. So it depends. See, the treatment needs to be tailored as per the patient. But yes, if taken under proper guidance, then antifungals are safe per se.
Okay, if someone is taking, by taking proper advice by the doctor, by proper treatment, then it is good. Otherwise, if people are, using the same cream again and again, they are thinking that, it is going better. So, is that advisable? Because sometimes people do that, this cream is working on my fungal infection, so just apply that and, doesn't have any other medicine. Is it advisable?
No, it is not advisable again because the treatment needs to be tailored as per your age, the type of infection you are having, any other comorbid factors you are having, what is the cause of fungal infection. So there are multiple factors which help to decide the treatment. So no, it is not like if one tablet or one cream was prescribed to one patient, the same treatment will be prescribed for the second patient. So the treatment varies from patient to patient.
Okay, doctor. And doctor, we have a live viewer question as well. There's a question that will cream help with my feet as well? Someone is having a ringworm in their feet. So why, how they can prevent the ringworm on the feet and the smelling of the feet?
See, firstly, consult a registered medical practitioner to know whether it is really a rash due to fungal infection or it is some other disease. Considering that it is really fungus, you start treatment as told by your skin specialist. Secondly, what precautions to take? Again, wear open footwear. um Wear separate footwear for your bathroom, or if you're going out in the rains. Avoid wearing socks till your fungal infection is cured, or even if you're wearing socks, try to remove your socks and shoes in between when you're taking breaks. Secondly, you can use a dryer to dry out your shoes. Cut your nails properly. The nail should not be cut too inside, but they should not be allowed to grow. They should be cut at a proper length. That is important.
Okay, okay, doctor. And doctor, what are the precautions one should take as the fungal infection does not affect the nails? Because in today's world, everybody wants to have good nails, and they also go to the nail bars as well, nail studios as well. So, is that affecting the nail, and is can occur the fungal infection if they're applying, some sort of nail paint or some sort of painting, which is a trend going on that. The nail extension. So is that good for the nails?
See, as such, wearing nail extensions don't lead to fungal infection. But yes, if you're doing pedicure or manicure and the instruments or the articles used are not properly washed or they are not decontaminated, then yes, it can lead to fungal infections. So choose your parlor well, you ensure that it is clean, it is hygienic. Secondly, using nail paints per se is unrelated because nail paint is just like paint over your nails. So, no, that won't lead to increased fungal infections. But yes, using instruments which can damage your nail, yes, they can lead to increased chances of fungal infection.
Okay, okay, doctor. And doctor, here are some question by a viewer related to applying the cream over the fungal infection. So there's a question that, ma'am, can I put powder too after applying the cream? And there's another question that, will it remove the black patches on my skin?
See, the black patches, if they are due to fungal infections, yes, they will go as the fungal infection is cured. So you don't need to worry about those. When your skin will start to heal after taking proper treatment, yes, the patches will also go. So you don't need to worry about it. And to answer the question with the powder, yes, see, the cream and the powder should not mix. If it mixes, it will lead to formation of a paste. So if you are applying your cream, space out the two things. After your cream is absorbed, let's say you can use your powder after 2 or 3 hours.
Okay, so first apply the cream, and after 2 or 3 hours, one should apply the powder over the infected area.
Yeah.
Okay, doctor. And doctor, as we have, there was a question that, my skin get hurt after applying the cream. There's another question related to it that, ma'am, why is my skin still red after using the antifungal cream?
See, if that is the case, you need to consult your doctor who has prescribed the cream. See, there are two possibilities. Either you are allergic to the cream or your skin barrier is damaged enough so that some components of the skin are further irritating your skin. So, yeah, these are 2 or 3 causes. So, you need to consult the doctor who has prescribed you that particular medication.
Okay, so please consult the doctor, because, as the doctor said, it is if it is hurting, then you should need to go to see a doctor. Doctor, also sometimes there is a myth that fungal infection is if somebody is having fungal infection, people go away from them, and so what is your take on the myth that if somebody is having fungal infection, people don't sit near to them, socially people don't go out because of the itching and the fungal infection. So what is your take on that?
Again, that is very wrong. See, fungal infections don't spread by talking to a person or they don't spread by eating food together or sitting in the same area. No, they will only spread if you're using their contaminated clothes or if you're sharing personal items like towels or soap. So there is no need to isolate the person. In fact, you should encourage someone who has fungal infection to take proper treatment. Fungal infections can be 100% treated provided that you take treatment from a proper doctor and follow the things which are told. So it is a completely 100% treatable disease.
Yes, and as you said, it is a treatable disease, so please treat it properly. And if it is taking too long, that then also please treat it, because it is important to take care of your skin as well. Doctor, when we are talking about fungal infection, we have talked about the antifungal medicines which need to be taken. There's come another question from a viewer that if someone's skin is broken, will the antifungal cream will help in that as well?
No, if your skin is broken, usually antifungal creams are not prescribed. In that case, see again, the treatment is tailored as per what is the cause for the broken skin. Whether the skin is burnt, whether it is scratched, or whether it is irritated. So it depends on that. So you need to consult your doctors to see what is the problem.
Okay, doctor. And doctor, what are the triggering factors of the fungal infection if someone is having fungal infection? And sometimes people go out in the garden or eat some kind of food as well. They trigger the fungal infection. So is it like that? People should take precautions about that as well.
As far as diet is concerned, no, there are no specific precautions related to diet. It's just that you need to have a healthy, balanced diet so that your immunity is good. Even if you do get fungal infections, they will get treated properly. If your immunity is bad, if you don't have a healthy diet, then yes, due to bad immunity, fungal infections will prolong. And as far as outdoor activities are concerned, if you take proper precautions, even if you're going to the swimming pool or going to the garden, going to the farms, if you're taking proper precautions, having a proper bath, maintaining cleanliness, then no, it is completely safe.
Okay, doctor. So, and fungal infection have a treatment as well, because people think that if someone is having fungal infection, these cannot be treated. So, we have discussed about the various type of fungal infection, how they can be treated, and how prolonged the treatment can work. So, if you are having any kind of symptoms, please to go to a doctor, because as Dr. Mugdha Kulkarni ma'am said, that it is very important to not treat your fungal infection by your own. Doctor, what is your advice to all the people who truly believe with the myth and the fact, and if any myth you want to clear about the fungal infections as well?
See, firstly, what people believe is that it will keep occurring in all seasons. Why to treat it? It will come, it will go as the season changes. So, no, that is not the case. Even if you do getting fungal infections in the hot and humid climate, let's say rainy season, it's not that it will go on its own when the winter comes. You need to treat it. So that is one myth which people have. Secondly, people feel that applying home remedies such as oil will cure the fungal infection. Again, that is not the case. In fact, using any kind of oil might increase the fungal infection. Why? Because the fungus uses the oil as nutrition. So if you apply oil on the fungal infection, it will increase further.
Okay, so do not take any kind of home remedies, as doctor said. And doctor, now what do you think that how social media plays an important role in fungal infections? And there are a lot of people talking about fungal infection, and people think that if somebody is using this particular type of cream or say powder, it is affecting them. So we should also use that. What is your take on that?
See, firstly, not just skin diseases or not just fungal infection, overall, also, it is never that a single medication is used for all the patients. Treatment is always specific to a particular patient. So the treatment varies on what is your age, whether you're pregnant, whether you're lactating, whether you have any liver, kidney, or heart diseases, whether you're diabetic, you have BP. So, yes, the patient profile varies, so the treatment also varies. So, it is not like one cream and one tablet is for all the patients. The treatment will vary as per patient to patient, and that is the case with all skin diseases, or for that matter, all kinds of diseases. Even if you say, take a simple example like diabetes or hypertension, it is not like one person has sugar in your family, you're using the same treatment for a second person who has diabetes. So it is the same with fungal infections also. Just because one cream, one capsule is working for you doesn't mean it will work for the other patient also. Similarly, each cream, each lotion, each tablet or capsule, they have their own set of side effects. They are not something that you have to consume on your own like a chocolate or like a chewing gum. Each medication, however simple it might be, has its own set of side effects. So it is good to not experiment and consult a proper registered medical practitioner who can, treat you well.
Rightly said, ma'am, and very valuable information. As you said that one particular cream or one particular tablet cannot treat everyone's affected areas and infections as well. Doctor, we also have some livelier questions asking about the fruits that do sweet fruit increase fungal infection, or do grapes make fungal infection worse? Is it like that?
No, again, it is not really, diet is not really related to fungal infections except if you're diabetic. If you're diabetic, probably see, eating sugary things will worsen your diabetes. If your diabetes gets worse, your immunity gets worse, and so the fungal infection gets worse. So, yes, if you have other diseases, then yes, it might affect your fungal infection. But if you are otherwise healthy, then no, you can have a normal, regular diet.
Okay, so diet does not affect fungal infection. If you are having some other sort of disease, then they might affect, as a doctor said. Doctor, it was so valuable session. Before we end this live session, any advice and anything you would like to say to all our viewers? Any information, important information which we have missed out? If you want to give to everyone, few words to all the viewers watching this live, because as you have given us the important information about antifungal, fungal infection, how to treat them, what are the symptoms. So, what is your advice to all the people watching this live right now?
Yes, one important advice which I want to tell everyone is that not every itchy thing, or not every itchy thing on the skin, or not every red rash is a fungal infection. What people often feel is, I have this red rash, I have this itchy thing, तो ये fungal ही होगा, but that is not the case. Yes, fungal infections are common. Even in our day-to-day dermatological practice, we get a lot of patients with fungal infection. That doesn't mean that everything red or everything itchy is a fungal infection. So it is advisable to not self-treat. Go to a proper doctor who will first diagnose your disease and give you treatment accordingly.
Okay, so as doctor said, do not treat your fungal infection go to doctor before treating. And in every red rash and itching is not a fungal infection, so you have to go to see a doctor. Do not take over the counter medications, and do not self treat your fungal infections. Thank you so much, Dr. Mugdha Kulkarni ma'am, for your valuable time. And it has been very quite an informative sessions for all our viewers. And we really look forward for many more such sessions in the coming time as well, Doctor.
Yes, thank you very much for having me here. It was great having this session with you all. Thank you very much.
Thank you. Thank you so much, Doctor. And thank you to all the viewers for an excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and good day to you all.